This video is going to cover the PS Occiput correction for Gonstead cervical chair. You're already familiar with this correction because it's the same correction as you learned in full spine with your thenar contact. The challenge is we're going to take that patient that's usually supine with our work right in front of us. We're going to take that patient now in the seated position. We're going to turn them 90 degrees. So now we have to really turn our orientation for the adjustment 90 degrees, and that's where it gets a little awkward. It's a thenar contact on the segmental contact of the mastoid groove, the ridge right behind the ear here. Same process. We know where the contact point is. I'm going to take the patient's chin and head and just rest it in my palm on the left side. Kind of open up the contact area. I'm going to take my thenar. I'm going to sweep the hair out of the way. Slide it down and lock in the contact. My fingers are swept behind the occiput. My thumb is now oriented down the SCM. And as I feed in, I'm going to bring the patient's attention this way, keeping my P to A, so my elbow stays in close by my side. P to A, S to I, and lateral to medium. Okay? Seems very simple, but it gets a little awkward when you have to turn your hands upside down for this adjustment. That's pretty much it, and we'll see you on the next video. One other thing I need to add for the PS correction, we are going to move the patient's head to accommodate for the third component of the listing. We have a PS, which we know is called posterior and superior. We have a RS, where the open capsule between occiput and atlas is on the right. And then we can have a RA or an RP. Just like with atlas, if it's an ASRA, I'll rotate the patient's head 5 degrees towards the contact. If it's an ASRP, I'll rotate the patient's head 5 degrees away from the contact to correct the last component of the rotation.